Hello and welcome to the DULCE Parent Advisor Orientation. This is a short video for parent leaders who are interested in joining the council, just to provide a little background about the work and give you an idea of what it's like to be an advisor on the DULCE Family Advisory Council. As we go through this presentation, you'll see some abbreviations, and I'll be talking in some of these, so I just want to make sure you know what I'm saying when I use these. So DULCE stands for Developmental Understanding and Legal Collaboration for Everyone. VCHIP is the organization that I work for, which is the Vermont Children's Health Improvement Program, which is based at UVM, the University of Vermont, in the Larner College of Medicine, or LCOM. And we partner with the Vermont Department of Health in this DULCE work. So this is the Vermont DULCE team. So as I mentioned, VDH and VCHIP work together to support DULCE in Vermont. On our VDH team, we have Lauren Eicher and Laura Pentonreader, and our VCHIP team is Brina Holmes and myself, Rachel Wallace-Brodeur. So I support implementation at DULCE at all the Vermont sites and help facilitate the DULCE Family Advisory Council. So I want to provide a little background about the organization I work for, VCHIP. So VCHIP is a population-based child and family health services research and quality improvement program at the University of Vermont. So really what that means is that we work with public health, medical practices, policy folks, community partners to improve care for Vermont's children and families. And we use a quality improvement approach, measurement-based process to do that. Our goals at VCHIP are to promote the will to change, so really inspire our clinical partners to improve care. We support collaboration among public and private health organizations to make those sustainable improvements in care. We share those results, disseminate them through presentations or articles, and then we work to translate new research and methods into practice. And we do all this with our expertise in improvement scientists, science, and public health, and quality improvement. So VCHIP has a lot of focus areas, and we really work across the whole childhood span, from perinatal health through young adult health. The DULCE work is based in our early childhood programs. So I told you what DULCE stands for, but what does that really mean when we think about the program? So developmental understanding is really about supporting the relational health of infants and their families. Legal collaboration is helping families access the concrete supports that they want and are legally entitled to, and for everyone. So DULCE is universal at the practices that have DULCE. There's no eligibility criteria because we recognize that all families with new babies could use some extra support. The mission of DULCE is to really transform the way that families with infants experience the delivery of support and services. And they do this by employing a cross-sector, team-based model that proactively supports the health of families with infants. And the vision of DULCE is that when DULCE is fully implemented nationwide, all families with infants will experience holistic, connected care and receive the support they need to provide newborns with a healthy start in life. So DULCE is an approach that was developed in Massachusetts. It was tested by randomized controlled trials, and then they are working to spread the model. So the way DULCE is organized is it really brings together three sectors to support families. The early childhood sector that has expertise in community supports and programs that help families. And in Vermont, that early childhood sector is our parent-child centers. The legal sector, which has expertise in ensuring that families get those access to supports they need. In Vermont, our legal partner is Vermont Legal Aid. We have an attorney there who works with all our Dulce sites. And then the healthcare sector. So those pediatrics serving medical practices, which is where Dulce is based, and where you're interacting with Dulce, because that's where families with young children are. They're bringing their newborns to those regular well child visits. And Dulce really uses this interdisciplinary team to support families. So families are at the center, and the team really works to kind of scaffold and support families in the ways that families need. So you're probably most familiar with the family specialist who attended your well visits and provided materials to you, and the medical provider for your child. But also on the team is a mental health representative, an early childhood system representative, that legal partner, and there might be a clinical administrator. And this team meets regularly, weekly, to talk about all Dulce families and identify what their strengths are and where there may be opportunities for support. We have 8 Dulce sites in Vermont. So as I mentioned, this was an approach developed in Massachusetts, and when they spread it, one of their pilot sites to spread it was in Morrisville. So that was the first site in Vermont, and it was their test of the model in a rural setting because it was developed in an urban setting. It was so successful in Lamoille that the Vermont Department of Health really recognized this as a great model, and we've been working to spread it since. So we now have these 8 active sites. So Dulce was originally designed to support families 0 to 6 months. 4 of our sites have expanded to support families from birth to 12 months, that first year of life. So we have 4 sites that go for 6 months and 4 that go for a year. So why do we have a Dulce Family Advisory Council? Because, as I said, Dulces are the center of Dulce. And we can't support families unless we have family voice included in the planning and implementation, because we need to make sure that Dulce is supporting families in the way that is meaningful to them and addresses the needs that they have. The way the Dulce Family Advisory Council is structured is our goal is to have 1 to 2 parents from each Vermont Dulce site. The group meets once a month on Zoom, and then we sometimes have other opportunities for parent leaders to participate in if they choose. I will say the meetings are all work is done during these meetings. And we know that you may be actively parenting, so it's not unusual that a parent has a child with them or playing in the background, and just know that that is totally fine. We love seeing children at these meetings. I do send out an agenda before each meeting so you know what to anticipate, and all work is done during that meeting time. So there's no work that's expected to happen outside that hour that we're meeting. So as a Dulce advisor, kind of the criteria is that an advisor needs to have participated in Dulce with their child or children. And you'll really help improve the patient experience and quality of care at Dulce sites by giving feedback based on your own experience. And we do ask advisors to commit their time to the advisory council. As I said, we meet for 1 hour once a month, and it's really important to try to make those monthly meetings. We know things will come up sometimes where you'll need to miss, but if you can't, if you don't anticipate that you'd be able to meet those monthly meetings on a regular basis, this may not be a good fit. And advisors really help improve our work in a number of ways. So your insight about strengths or areas where changes may be needed really help us develop priorities and make improvements based on your identified needs. We help develop new ideas and solutions that overall improve the quality and safety of care for children. Our core advisor principles are that we want our advisors to respect confidentiality and honor privacy when applicable, respect diverse and differing opinions. We want our advisors to show compassion and withhold judgment, and to communicate openly and maintain open communication. How VCHIP will help advisors: we will provide interpreter services if needed. We work to create an open and respectful environment. We will listen and respond to your ideas and suggestions. We'll keep you informed about how your feedback and ideas are shaping our work, and we'll provide payment for your time. So some examples of work that the Family Advisory Council has done in the past. One is they created the Dulce Exit Survey, which you may have seen, to get feedback from families who have completed Dulce. They were also instrumental in kind of defining the process of giving the survey that resulted in a huge increase in the number of families who complete the survey. Our advisors wrote the job description for Dulce advisors. They co-created a brochure describing the Dulce legal partner's role, because we recognize that many families, one, maybe weren't aware of what the Dulce legal partner did, but also what areas they could help with. So this really laid out topics where the lawyer may be able to help families. And then they developed the flyer to support new parents that we just wrapped up, so that will be going out to families soon, but really excited about that work. Kind of the idea of parents supporting parents of new babies. So, if you are interested in becoming a Dulce Family Advisor, your next step is to fill out the W-9 form. The Parent-Child Center pays the family advisors. So, after you complete that form, you'll mail it to the address that I provided in your welcome email. And then you'll start attending the monthly Dulce Family Advisory Council meetings. So really excited that you're interested in joining this group. It's a really wonderful group of parents. I love to work with them, and I look forward to meeting you and working with you.